Hello and welcome. Today we're diving into a really important topic that affects many families: high blood sugar and diabetes during pregnancy. Whether you already have diabetes or develop it during pregnancy, known as gestational diabetes, understanding the risks and how to manage them is key for a healthy mum and baby. So, let's get into it. Pregnancy is a time of incredible change, and your hormones go on quite a ride. These hormonal shifts can make it harder for your body to use insulin effectively. This is why some women develop gestational diabetes, and why those with pre-existing type 1 or type 2 diabetes might find their blood sugar harder to control. So, why is this a big deal? Medical studies are very clear on this. High blood sugar, especially early in pregnancy, increases the risk of birth defects, particularly affecting the baby's heart, central nervous system, and kidneys. It also unfortunately raises the risk of miscarriage. What happens is that excess glucose from the mother AS blood crosses the placenta and can interfere with the baby's development right from the start. As the pregnancy progresses, a different set of risks emerges. If blood sugar remains high, the baby can grow much larger than average, a condition called fetal macrosomia. A very large baby can lead to a difficult birth, potential birth injuries like shoulder dystocia, and a higher chance of needing a C-section. And it's not just about the baby, the mother's health is also at risk. Uncontrolled blood sugar increases the chances of developing preeclampsia. This is a serious condition involving high blood pressure and organ-related issues that can be life-threatening for both mum and baby. Let's talk about what happens right after birth. A baby who is exposed to high glucose levels in the womb has been producing extra insulin to handle all that sugar. Once they're born and the glucose supply from the mother is cut off, their own high insulin levels can cause their blood sugar to drop dangerously low. This is called neonatal hypoglycemia. These babies are also more prone to jaundice and respiratory distress, often needing immediate medical care in the neonatal unit. The story doesn't end at delivery for the mother either. Women who have gestational diabetes are much more likely to develop type 2 diabetes later in life. They also have a higher long-term risk for cardiovascular disease. So, managing this during pregnancy is really an investment in your future health. Because the stakes are high, specialised professional care is non-negotiable. If you have elevated blood sugar or diabetes during pregnancy, you should be working closely with a healthcare team. This usually includes your obstetrician and an endocrinologist, or your primary care doctor. They'll monitor your blood glucose, blood pressure, and your baby's growth and well-being. Regular tests like the hemoglobin A1C, along with daily blood sugar checks at home, are standard parts of this care. Now, let's talk about one of the most powerful tools you have: nutrition. Working with a registered dietitian or nutritionist is fundamental. They can create a personalised eating plan that meets your metabolic needs and nourishes your growing baby. This isn't about a super restrictive diet. It's about balance. The general advice is to eat smaller, more frequent meals throughout the day to keep your blood sugar stable. You'll want to focus on complex carbohydrates with lots of fibre, like whole grains and vegetables, and avoid simple sugars found in sweets and processed foods. Getting enough protein and healthy fats is also crucial. Sticking to regular meal times helps your body get into a predictable rhythm. A professional can guide you toward natural foods that support blood sugar control, all within a safe, balanced plan. Something that often gets overlooked is hydration. It's always important, but during pregnancy, your fluid needs increase significantly. Water is essential for your increased blood volume, for creating amniotic fluid, transporting nutrients, and keeping your kidneys working properly. Staying well hydrated actually helps with blood sugar control, prevents urinary tract infections, and just keeps your whole system running smoothly. How much should you drink? Your healthcare provider can give you a personalised recommendation based on your body, activity level, and the climate. The key is to sip water consistently throughout the day and steer clear of sugary drinks. Physical activity is another game changer. Gentle to moderate exercise, like walking or specific prenatal workouts, can do wonders for improving your body's sensitivity to insulin. Of course, any exercise plan must be approved by your doctor or a qualified fitness professional who understands pregnancy. They'll ensure it's safe for you and your baby at every stage. Sometimes, even with the best diet and exercise plan, medication is necessary, and that's perfectly okay. Insulin is the most common medication used, and it's considered safe during pregnancy when prescribed and managed by your doctor. The most important thing is to never self-medicate or take supplements without professional guidance. So, to wrap it all up, managing your blood sugar during pregnancy is a team effort, and you are the most important player on that team. Attend all your prenatal appointments, do your recommended tests, and monitor your glucose as instructed. Prioritize healthy sleep and find ways to manage stress, as these also impact your blood sugar. Think of it this way. Taking care of your blood sugar now is not just a temporary chore. It's a profound act of love for your baby and for yourself, setting you both up for a healthier future. If you are pregnant and dealing with high blood sugar or diabetes, please don't wait. Reach out to your healthcare team. Follow their advice on medicine, nutrition, and exercise. Stay hydrated. By taking these steps, you are paving the way for a safer, healthier, and happier pregnancy journey. Thank you so much for watching. If you found this information helpful, please give this video a like and subscribe for more content on health and wellness. Take care of yourselves, and we'll see you in the next video.